Hello everyone, welcome to my next video on cervicocerebral angiography and the CPT coding guidelines for it. First, let us see what is a cerebral angiogram. Cerebral angiography is a procedure that uses a special dye or a contrast material and X-rays to see how blood flows through the brain. So this is the method which is used to check the blood flow of the brain and the associated structures. So what they will do is they will inject a dye material or a contrast material into the blood vessels of the brain and neck, and they will take an X-ray imaging of them so that we can identify problems like abnormal blood vessels in the brain or vascular malformations, or if there is any bulging of the blood vessel like aneurysm, or if there is any narrowing of arteries if it is there, and also inflammation of the blood vessels in the brain called as vasculitis. To identify all these problems, they do this angiography, and also it is used sometimes to identify blood flow to a tumor of the brain and evaluate the arteries of the head and neck before doing a surgery and finding out the clot which might have caused stroke in the patient. So for all these purposes, we do this cervicocerebral angiography procedure, and also we use it for certain treatment procedures also, like interventional radiological procedures which is done in the brain, and also for procedures like treatment of stroke. For that also we use these procedures as a part of treatment. So this is how we do this cervicocerebral angiogram. Now in the next slide you can see the images what we get when we do this cervicocerebral angiogram. You can clearly see the blood vessels and the blood that is flowing through the neck and also through the brain. So cervical means it refers to the neck, cerebral means it refers to the brain. So here we are mainly checking the blood vessels and the blood circulation within the neck and also brain. So in this picture, clearly we can see the blood vessels on both sides of the brain. So these are the blood vessels which are supplying the brain. So now we'll move to the CPT book. There we can see about the diagnostic studies of cervicocerebral arteries. And before that, you should know the difference between selective and non-selective catheterization. A non-selective catheterization means putting the catheter in aorta. How it is done? First, they will get an access point either through the femoral artery in the thigh region or through the radial artery in the arm region. They do this. They insert the catheter and go into the aorta, and if the catheter is not traveling beyond that, that is considered as non-selective catheterization. But if the catheter is crossing the aorta and entering into any of its branch arteries, it is called as a selective catheterization. So that means we are specifically entering inside a specific vessel. So it is called as selective catheterization. And also we have to check into which vascular family the catheter is entering. Based on that, we have to report the codes, whether it is in the upper extremity or for the abdominal region or for the renal arteries or for the lower extremity. So we have to check that, and based on the family, we have to code it independently. And also you should remember that whenever a catheter is traveling from first order artery and it is entering into the second order artery, or it is going into the third order artery, we have to report only the third order artery. We don't have to report the first order, because it is understood that when we reach the third order artery, we have crossed first and second order to reach the third artery. So we don't have to report it separately. And if an additional second order or a third order artery is catheterized, we have to report them separately. So all these things we have to check before we report these codes for this cervicocerebral angiography procedures. Now let us move to the codes. The first procedure code is 36200. It says that introduction of catheter into the aorta. So what type of catheterization is this? This is a non-selective catheterization. And also below this code, one important guideline is there. For non-selective angiography of the extracranial, carotid or cerebral vessels and the cervicocerebral arch, when performed, you have to report the code 36221. Even though it is a non-selective catheterization, they do angiography with the help of this procedure to check external carotid and cerebral vessels and cervicocerebral arch. So we have a separate code for it. Now moving to the second code, 36215. From this code 36215 till 36218 will be used for upper extremity catheterization. That means the blood vessels which are supplying the upper extremity are catheterized here. that belongs to the vascular family of thoracic or brachiocephalic branches. And 36215 will be used for selective catheter placement in each first order. That means for every first order artery that is catheterized in the thoracic region or in the brachiocephalic region, you can use this code 36215. And 36216 will be used for initial second order. That means after crossing the first order, if we are entering into the second order, we can use 36216. And 36217 will be used for initial third order or more selective thoracic or brachiocephalic branch within a vascular family. So in the upper extremity region, if we are going to enter inside a third order artery, we have to report 217. And the next code is 36218, which will be used for any other additional second order or third order and beyond that. You can use this code 36218. And remember that there is no need of multiplication. Whatever the number of arteries that are catheterized after initial second order or third order, you can use this 36218. And what are these first order, second order and third order arteries? How to identify them? For that, you have to take the vascular families appendix in your book, Appendix L. There you can see the different parts of aorta and their branches. For example, from the thoracic aorta, we get right and left coronary artery. Then we get innominate artery or brachiocephalic artery and left common carotid artery. And then we have left subclavian artery and left axillary artery, which are taken as one artery. Like that, there are some other arteries like bronchial artery and other things. Now we will see some main artery and its first order, second order and third order arteries. So now we will see about the artery innominate or brachiocephalic artery. That is a first order branch coming out from thoracic aorta. And from that we get multiple branches. For example, we have right common carotid artery, right subclavian artery and right axillary artery. These are the branches that come out directly from the innominate artery. And from right common carotid artery, we get right internal carotid artery and right external carotid artery. And from subclavian artery, we get right vertebral artery, right internal thoracic artery, right thyrocervical artery, and right costocervical artery. So like that, from each artery, we get multiple branches. And how they are named as first order, second order, and third order arteries. Arteries which come out directly from aorta. That means the branches of aorta are called as first order artery. Now we'll just consider them like the children of aorta. First order arteries are children of aorta. And like children are getting married, they get their own family. So this mother aorta now has become grandmother. She has got her grandchildren. So second order arteries which come out from the first order branch of arteries are called as the grandchildren now. So you can consider it like that. So thoracic aorta is a mother. Now she has become grandmother and she has got second order branches. They are called as the grandchildren. Now from the second order, for example, these grandchildren are getting married and they have their own family and their children. So those children who have come to the world from second order artery, they are called as the third order artery, are the great grandchildren. So like this, you can easily remember the first order, second order and third order arteries. Aorta is a mother and the first order arteries are her children. And from the first order artery, she has got second order arteries. They are called as the grandchildren. And then we get the third order arteries from the second order artery. They will be called as the great grandchildren. And even after third order arteries, we have some more arteries, but they are not given as any specific order because they will become very tiny arteries. So they are not called as any order. And also I'll give you one more example to report these codes. Like for example, if I'm going into a third order artery, I have to report only the third order artery, but not the first and second order. Just imagine that from India, I'm going to United States of America. But in between, I'm like going through or traveling through UAE and UK. For example, my flight is starting from India, but it has got two layovers, one at Dubai and one is at London airport. And after that, I'm going to reach US. So now, how will I say that? I will say my friends and relatives that I'm traveling from India to US. I will not mention that I'm going in between to Dubai and also I'm going to London. That is not needed. Just the destination is enough to say that like I have crossed all these areas to reach US. So like that, we have to report always the destination. We don't have to report the layover areas because it is understood that I have to cross Middle East countries, and also I have to cross United Kingdom, and then only I can reach the US. So in between I might be laying over there, but that will not be considered as a main area or my destination. Okay, now we'll move to the next code 36221. Already I have mentioned about the same code under 36200. So 36221 is used for non-selective catheter placement in thoracic aorta, but in addition to that they are doing angiography of extracranial carotid artery, vertebral artery and intracranial vessels. Now we'll move to 36222. 36222 is used for selective catheter placement into the common carotid artery or innominate artery, but it is used for unilateral procedure. That means either right side or left side I can do this procedure. It can be done by any approach with angiography of ipsilateral extracranial carotid circulation. Ipsilateral means on the same side. I am going to check the extracranial carotid circulation. Extracranial means outside the skull. And also in addition to that, I am going to do angiography of the cervicocerebral arch. So all these procedures, placement of catheter into common carotid or innominate artery, and also checking the same side extracranial carotid circulation, and also doing angiography of the cervicocerebral arch is included in 36222. Now we'll move to 36223. Just find out the difference between 222 and 223. It looks almost the same procedure, but there is a small difference. Here they do ipsilateral intracranial carotid circulation. So what does intracranial mean? Intracranial means inside the skull. Inside the skull, what do we have? We have the brain. So we are going to check the blood circulation within the carotid artery within the brain. And also doctor does angiography of extracranial carotid and cervicocerebral arch here. So all these are included in 36223. Now we'll move to the next code. 36224. Here the catheter is inserted into internal carotid artery and it is again unilateral with angiography of ipsilateral intracranial carotid circulation and all associated radiological supervision and interpretation, and this again includes angiography of the extracranial carotid and cervicocerebral arch. Here you can find out the difference between 22 and 24. In both almost the procedure is same. But the difference is the catheter is ending in internal carotid artery. Here also it is understood that if I have reached internal carotid artery, I cannot report 36222 and 36223 with 36224 because it is a higher order artery. We don't have to report them in addition to 36224. Now we will check 225. Here the catheter is placed in subclavian artery or innominate artery, again unilateral, with angiography of the ipsilateral vertebral circulation. So here we are going to check the circulation that is provided by vertebral artery, and all associated radiological supervision and interpretation is included, and this includes angiography of the cervicocerebral arch. So mainly the procedure is differing here. With the circulation we are checking, we are not checking carotid, but we are checking the vertebral circulation. Now we'll check 36226. It is again a selective catheter placement. It is placed in the vertebral artery and again unilateral for angiography of ipsilateral vertebral circulation. So this is like we are crossing the innominate artery and entering into the vertebral artery here. And with the help of this also we are doing an angiography of the cervicocerebral arch. Now apart from these we have some add-on codes 36227 and 228. We will check them. 227 is used for selective catheter placement into the external carotid artery. External carotid artery is also a branch of common carotid artery which supplies the face. So here also they are doing an unilateral procedure, angiography of the ipsilateral external carotid circulation and all associated radiological supervision and interpretation. Here there is no cervicocerebral arch angiography and all because it is not covering the blood vessels of the brain. It supplies mainly the face. So now we will check 36228. It is also an add-on code which is used for selective catheter placement. Each intracranial branch of internal carotid or vertebral arteries, that means they are traveling more beyond the internal carotid artery and vertebral arteries. In such a case, you have to use this add-on code for each branch of intracranial artery of internal carotid and vertebral artery unilateral, and again they are doing angiography of the selected vessel circulation and all associated radiological supervision and interpretation is included. And also in this code within bracket you can see the names of intracranial branches of these arteries: middle cerebral artery, posterior inferior cerebellar artery. So these are the branches that come out from internal carotid and vertebral arteries. So we can multiply this code maximum 2 times, not more than that. After this, we are moving into abdominal and pelvic artery catheterization. From the code 36245 to 36248 will be used for that purpose. And here also, if we are going to code the first order artery, you have to report 36245. For each first order abdominal, pelvic or lower extremity artery, we can use 36245, and for initial second order artery, we can use 36246. And for initial third order artery or more selective artery, we can use 36247. And again here also we have an add-on code 36248, which is used for additional second order, third order and beyond that. And in all these procedures, angiography procedure is not included. So if angiography is done, what code should we report? You have to report the code 75726. That is used for coding abdominal and pelvic arteries. 75726 is used for angiography of visceral, selective or supraselective with or without flush aortogram, radiological supervision and interpretation. That has to be added with all these codes 245 to 248. Lastly, we are moving into renal artery catheterization. Here we have 4 codes 36251 and 52 and 253 and 254. 251 and 252 will be used for first order renal arteries. The name of first order renal arteries are main renal artery and any other accessory renal artery. If we are doing a catheterization and also we are doing a renal angiography, we have to use these codes. But 51 is used for unilateral procedure, 52 is used for bilateral procedures. And the code 36253 will be used for super selective catheter placement into one or more second order or higher renal artery branches. Here also 53 will be used for unilateral procedures and 54 will be used for bilateral procedures. And here also you should understand that if the catheter has reached second order artery or beyond that, you should not report 53 with 51. That is not needed, because it is understood that if I have reached the second order artery, I have crossed the first order artery to reach the second order artery. So I will not report the first order artery separately along with 36253 and 54. So this is how we report these codes for renal artery catheterization. Now we will check the guidelines that are given in our book. Now I'm reading this paragraph. Do not report 36222, 36223 and 36224 together for ipsilateral angiography. That means on the same side, if I am doing all these procedures, I cannot report them together. I have to report only 24 if I am doing everything together. If I am doing only 23 and 22, I will report only 23. So in this paragraph, they have given the order of complexity and it is given in a descending order. The most complex procedure is 24. So if I have done that, it is understood that I have crossed all the other arteries to do this. So I need not report 22 and 23 in addition to 24. If I have did 23, I should not report 22 with it. And also for 36225 and 226, there also same guideline is applicable. 26 is the higher order complexity procedure. So we should not report 25 and 26 together. If you write 26, it is understood that we have done 25 also. Now we will read the next paragraph. When bilateral carotid and or vertebral arterial catheterization and imaging is performed, report the codes 36222, 223, 224, 225 and 226 with modifier 50 and report add-on codes 27 and 28 twice. Because with add-on codes we will not use modifier 50. So that is why they have mentioned it as we have to report them twice. Now we will read the example that is given in our book. For example, if bilateral extracranial carotid angiography with selective catheterization of each common carotid artery would be reported with 36222 and modifier 50. So we are just using modifier 50 with the procedure to say that we are doing the procedure bilaterally. Now we will read the next sentence. However, when different territories is studied in the same session on both sides of the body, modifiers may be required to report the imaging performed. In such a case, you have to use modifier 59 to denote that different carotid or vertebral arteries are being studied. For example, when selective right internal carotid artery catheterization accompanied by right extracranial and intracranial carotid angiography is followed by selective left common carotid artery catheterization with left extracranial carotid angiography is done. We have to report 36224 because that is the most complex procedure here, and also we have to report 36222 for the left side with modifier 59. And when we are reporting two different procedures, always remember that most complex procedures will be reported first. So according to the descending order of hierarchy, 24 is most complex. So we will report that first. In addition to that, we can report 22 with modifier 59 for the left side. And also there are some more guidelines. I'm reading the second paragraph after this. Do not report 36218 or 75774 as part of diagnostic angiography of the extracranial and intracranial cervicocerebral vessels. It may be appropriate to report 36218 and 75774 for diagnostic angiography of upper extremities and other vascular beds of the neck and shoulder girdle performed in the same session as vertebral angiography. So we need an additional code for angiography of extracranial, intracranial cervicocerebral vessels with 36218. And also within bracket you can see, for example, workup of a neck tumor that requires catheterization and angiography of the vertebral artery as well as other brachiocephalic arteries can be reported like this. The last guideline which is given here is report 76376 or 76377 from radiology chapter for 3D rendering if it is performed in addition to 36221 to 36228. And one more guideline, report 76937 for ultrasound guidelines for vascular access when it is performed in conjunction with 36221 to 228. That means we need additional codes for 3D rendering procedure in addition to 21 to 28, and also 76937 can be used for ultrasonic guidance. Like when we do this procedure, starting with the vascular access, we enter into the femoral artery or through the radial artery. So during that time, if we use ultrasonic guidance, we can use 76937 in addition to these codes. So this is all about the cervicocerebral angiography procedures. Like I have tried to cover everything in this video. If you have any doubts, please drop in a comment. I'm ready to answer your doubts. And I hope this video will be very helpful to you all when learning this procedure. And don't forget to subscribe my channel. Thank you.